Are you sick and tired of bad healthcare experiences? Give me the next 5 minutes and I'm going to give you 3 easy hacks to get better healthcare experiences and outcomes. And because I know medical terminology and anything related to your health can be really overwhelming, I put together a free resource guide for you. Just leave me a comment down below this video and I'll drop it in your messenger. There's no email required or opt-in or phone number or anything like that. This is my gift to you for watching my video. Now, for those of you who don't know me, my name is Rosa Crumpton. I'm a researcher turned nurse and health equity advocate. I've had my personal share of bad healthcare experiences as a Black woman, as a young person, and even as an older person. And as a healthcare provider, I've seen a lot of people fall through the cracks that don't know how to advocate for themselves. So again, just give me the next couple minutes and I'm gonna give you these 3 actionable steps to improve your healthcare experiences and outcomes. Are you ready? Okay, number 1, primary care provider. I need you to establish care with a primary care provider. This doesn't necessarily have to be an MD, which is a medical doctor. It could also be a nurse practitioner. It could be a DO, a doctor of osteopathy. It could be an ND, a naturopathic doctor. It could be a physician assistant. Those are the major categories of providers that can work as a primary care provider. Now, this is so important to establish care before you have a health crisis. A primary care provider is the person that correlates all of your health history, your family medical history, your personal health history, what's going on with you currently, your lab values, any special testing. They're the ones who put in the referrals for you to go see specialists if you have some kind of specialized thing going on, and then they assimilate all that information to help you with your plan of care. This is somebody that I want you to like and to trust, because if you do have some kind of health thing crop up where you maybe have to go to the hospital or whatever, this is a person that's again knows your history, that you already established care with, and is not some emergency room provider that you're seeing for the first time that's trying to put all the information from your background and your history plus what's going on with you. So please find your primary care provider. Number 2, speak up. A lot of times, especially if you are a person of color, if you are a marginalized person, if you are a woman, you have been spoken over, you've been told that you don't know what's going on with your health or your body. And this can lead to a lot of personal trust issues where you start second guessing yourself. You really don't feel that you can speak up. And there's a lot of historic context and things like that, which is outside the scope of this video. But if you don't feel comfortable with the plan of care, please speak up. If you are having pain or some other symptom that just is not resolving, I need you to speak up until you get the care that you need. Number 3, find support. The internet has made the world a smaller place, and sometimes that is a blessing and sometimes is a curse. But right now we're going to focus on the blessing. There are so many people that may have your condition or your symptoms that you can talk with and get feedback. Sometimes that just helps confirmation that something is actually going on, because again, back to point 2, sometimes as marginalized people, we have been taught not to trust ourselves or intuition. So when you find your support group, you find your people, this can help you know about other research studies that are going on, finding out what type of testing, what kind of specialist you should go to. Maybe you have to have your doctor, your primary care provider, maybe not necessarily a doctor, but your primary care provider, maybe they can connect with somebody who's doing some really innovative care. So again, find that support. I do want to give you the caveat that, excuse me, that you need to vet these things for yourself. Don't just believe anything on the internet, whether they're a support group, whether they say that they have every single symptom that you have. Again, you need to do your own research, find out if this is a trusted source, and take that back to your primary care provider, this information that you've discovered, that you've found out. So I do want to give my other caveat that although I am a nurse, this is not medical information for you specifically. These are guidelines and education. You need to, again, establish care with your own provider. I can't provide medical advice over the internet, but I can help you advocate for yourself. So Just like dating, it can be hard to put yourself out there if you've had a bad healthcare experience. But I want to help support you in your advocacy and getting better healthcare experiences and outcomes. So if you want that resource guide that I put together just for you, just leave me a comment down below this video and I'll send it right over on Messenger. Again, no email, no opt-in required, just a gift for watching. So thank you.